So we're very excited to start our second episode of The Other Side of Adversity. We have a very exciting guest today whose story I'm going to summarize first. It's Dr. Paul Constanti. Dr. Paul is a chiropractor and owns the Dynamic Health Clinic. Is that right, Paul?
Yeah, it's Dynamic Medical Chiropractic and Rehab, or Dynamic Healthcare.
Could you do me a favor? Where is that located, and what is the phone number so somebody could reach you there?
Yeah, we're in Louisville, Kentucky, 502-426-9200, 502-426-9200.
Awesome. You know what I'm going to do at the end of the show? I'm going to ask again for all your contacts. But Dr. Paul was skiing. How long ago were you skiing when this happened, Paul?
This happened to me, the accident happened 32 years ago, just about 32 years ago.
32 years ago, he was skiing. He'll go into more detail about it, but he fell, broke his neck, and was paralyzed for a while. And now you can see he is perfect again. I mean, he was perfect before, and he's perfect again, so it worked out great.
Well, I'm working on it, put it that way.
Are you trying to say you're not perfect? I don't believe it.
No, be careful of people who claim to be perfect and end up on a cross.
Understood. So, Dr. Paul, do me a favor. Just go back 32 years ago. I hate to bring you right back to that incident, but what happened?
So it was basically 3 months after I graduated out of grad school, December maybe 22nd of 1988. I'm skiing a head wall out of Bear Mountain in California.
What is a head wall?
It's a steep pitch. That's a steep pitch of a slope. They call them head walls where the like one glade, and it was icy out. And I always like to ski on the edge of the runs where the snow is softer. And then I caught an edge, and I fell, and I was doing about like 25 miles an hour, going head first. And I'm at the edge, and I see a tree coming at me. And I just said, God save me. I hit this tree, and I pass out, and I wake up to the sound of a faucet, and it's actually the sound of blood pouring out of my head and my face.
Oh, my God.
And I ended up down in a ravine, and I ended up blowing my eye through the orbit, got completely scalped. And then some years later, I lost my front teeth, and I was skiing with a friend of mine, and he actually came and he got ski patrol because they finally came and found me. And when ski patrol found me, when they flipped me over, they didn't sever my spinal cord, which was awesome.
Wow. Now, were you with somebody else? Like, how did they even know to look for you?
I was with somebody else who had lost, had kind of didn't know where I was, and he kind of looked down and found me. But what was really crazy about the situation was I'm up at Bear Mountain, about 100 miles from where I live in California back at the time. And my chiropractic assistant, the lady that runs my front desk, her brother's roommate found me in the ravine. She's from...
No way.
Her brother's roommate found me in the ravine. They sled me down to there. They stabilized me. And then they had to do an air evac to San Bernardino County Hospital. And from there... It was about a 13-hour search. First, they had to redock my spine because my spine dislocated about 80%, and they had to get me up to 50 pounds of traction to redock the spine before they could fuse it. They did a fat patch in my cord, and it was about a 13-hour surgery to fuse my spine. And also, my eye had blown through the orbit, and all the plastic surgeons were on Christmas vacation, so they didn't deal with that until about a month later.
Dr. Paul, are you awake for all of this, or are you pretty much out?
Yeah, I'm awake through all this stuff.
And what are you thinking at this time?
Oh my God! I mean, I'm in so much pain. I mean, I'm screaming, "Give me some drugs! Get me out of this pain!" And one of the craziest memories I have is, and I'm in San Bernardino County. I'm probably 3 days from my fusion. I'm maybe 40 pounds of traction. And a 6.6 earthquake goes off while I'm in traction.
Oh my God!
It was the craziest. The whole hospital's bending side to side, and so then they eventually fused my neck, and I'm in immense pain. And they get me out to recovery, and I'm in a room up by myself. and I had demons after me. I mean, I was hallucinating and had demons after me. And then this Latin priest came in and anointed me, and all the demons went away. So it was like a really wild experience.
Now, when you're saying demons, you had brain trauma, obviously.
I had brain trauma and hallucinations.
Right.
And through a stronger faith, man, the hallucinations went away.
Now, that was actually going to be my next question. Were you paralyzed after that?
Yeah, I was paralyzed, both legs, my left arm. The only thing worked was my right hand. And I had about 8 days left on my health insurance. I just graduated chiropractic college and moved out to California. And I remember dialing Blue Cross, an old touch-tone phone, with my tongue, because that's the only way I could dial.
Oh, my God.
Trying to get my policy extended. And then what was really kind of beautiful was one of my patients, who was the head of occupational med at Long Beach Memorial, I was in an indigent hospital, San Bernardino County, which had a phenomenal trauma team from Loma Linda University, put my neck back together. But she got me out of there and transferred me to Long Beach Memorial, where she got the head of plastic surgery from UCLA come out, and he actually took a rib right out of here on me, and actually put it underneath this left eye. The eyeball went to the bottom of the orbit. They lifted the eyeball up, put a ribbon, made a scaffold for that eyeball, took out my right part of my lower ilium, diffused my neck, C4 to C7.
Oh my! Now let me ask. So you're pretty much out of it. You're seeing demons. Are they talking to you, saying that there's hope or there's no hope, or what are you?
No, they were kind of trying to take me to hell. It was crazy. It was the wickedest hallucinations I ever had.
I mean, the doctors, are they talking to you, saying you're going to be fine, or are they saying?
So this is when they finally transferred me. So when they finally transferred me over to to Long Beach Memorial, a neurologist comes in and actually puts his finger in my rectum, and it actually puckered, which says you're going to walk again.
Oh my God.
And I've, basically been lying in, a hospital bed for about 7 weeks. And I finally got into the occupational medicine part of Long Beach Memorial, where they taught me how to dress myself, open cardboard boxes, button your clothes, how to walk.
Now, I had a stroke. I'm paralyzed on my left side. So for people that have not been through this, it's hard to imagine not being able to put a shirt on. But for me, that was the most difficult thing, was just learning how to put a shirt back on. Because if you can't extend your arm, you can't put your arm through a sleeve. You actually have to pull it through. It's almost a totally different way to dress yourself.
Yeah, the whole thing was just so wild. And then they finally left after they rebuilt my face. I'm still in the halo, and I think I sent you some pictures. I don't know if you have those pictures to show me of the halo.
I think we did get it. I haven't seen them myself, but we are going to put it up.
We'll show them later. But
we will.
So I actually left the hospital February, like around the 10th, and my old boss, the guy I was an associate for, a great guy, still friends to this day, picks me up out of the hospital because my parents had already left, because I was moved from Atlanta out there. And they gave me some muscle relaxers. So I took a muscle relaxer and took a shower while I'm still in my halo in this jacket. The darn things kicked in, and I fell on the floor.
What with the halo on? Oh my God.
Naked on the floor, and I couldn't move. It was so crazy.
I got to tell you, I told my sister this, when I first took showers, it was the scariest thing, because being paralyzed, it's very slippery. And,
my God,
right?
yes.
I mean,
everything is so much more complicated.
The things that you take for granted, like just being able to jump in a shower and take a 5-minute shower and get out,
Oh, yeah.
I mean, but you just that was a very scary experience for a long time.
Yeah, so after that, I finally got out of my halo, and a really good friend of mine, my best friend growing up, came out to California to take care of me for a week, because I still couldn't, drive or do anything. The day I got out of my halo, I'm in a hard collar. I got a black eye patch because this left eye was stuck up and out and it didn't even track.
Can you see out of that eye now?
Yeah, so this is what's crazy. He's a chiropractor. He was a chiropractor for the Red Wings for years. He adjusted a compression fracture right between my shoulder blades, and my eye straightened out and started tracking.
Oh, my God.
So being a chiropractor and being involved in natural medicine, and even the surgeon who did my fusion, he's there with a Makita drill taking the screws out of my forehead right here in the back when he's taking the halo off. He said, wait 2 months and start getting your neck adjusted because you guys rehab necks better than we can. And if you think about this, for 4 fusions, I'd say that's pretty darn good range of motion.
Dr. Paul, when you're telling me how bad it was, you look amazing. I couldn't even tell that you had any injury. I mean, you look wonderful.
Well, the thing is, though, it's been a 30-year journey on how to keep myself healthy and manage myself. So, I've had all kinds of different procedures I've done over the years. The best thing I've done so far was stem cell injections in my neck. That really...
I have the stem cell injections in the neck. We do that in the foot, and it works great for pain. But you don't hear that many people talking about it. I want to put in a plug for you, Dr. Paul, because anytime I want to know anything about like cutting edge breakthroughs in medicine, I'll call you, and you know about it. You know the people that are on top of it. How do you do that? I mean, how are you on that cutting edge like that?
Well, I was very blessed because after I broke my neck, I practiced for 9 years in Mexico. Was part of a cancer AIDS treatment center back down there when AIDS came out in the early 90s. And it was nice to not have your mind, bogged down with all the paperwork and the bureaucracy of practicing here in the States. And then what I really realized and what I've learned is modern medicine is about 23 years behind what your doctor can treat you with that's been approved, FDA approved, insurance covered services about 23 years behind on the latest cutting edge technology. And over the years, I decided, I worked at different alternative clinics and developed our own mainstream / alternative clinic. And what I've learned is give patients a choice of we can do what your insurance does, or we can do things that are way ahead of the time. And the way I look at it is I love to mountain bike and I still ski.
You still ski right now? You still ski?
Yeah.
And you still mountain bike?
Yeah.
Dr. Paul, how long did it take before you were able to do those things? You were paralyzed, like you said, for a long time.
I got back into mountain biking about 3 years later, living in Mexico. But it took about 2 or 3 years to get my strength back, my motion back. And, I was very blessed to go down to Mexico and practice down there. I even was able to travel down to Central America to do some healing work with some people that were trained by the Mayan Indians down there. So I was always looking for whatever keeps me moving and walking and staying healthy. I want to give it back to my patients.
Dr. Paul, I know you had that halo removed, but in my heart, you did not. You still have the halo over you, my friend. I love you. You're just awesome. And we've been friends for a while, and I'm so glad that you recovered. And one more question for you. How your viewpoint, I mean, at one point, I'm assuming that you weren't sure that you were going to walk again, right? You had some idea, but it couldn't be like I'm guaranteed. How did you keep your emotions up? How did you keep positive? I know naturally you're a very positive person. Like I said, I've known you a long time. And
I think as part of just being raised with good parents and trying to do the right thing and wherever you are in any situation, it's a journey. And all you got to, what I've learned is just take the next step on that journey. Just keep trying to move forward, trying to make yourself 1% better every day or 0.5% better, and just never give up. The big thing was I'm not saying don't listen to your doctors, but listen to your doctors, but also have knowledge of looking beyond that and always trying to, make yourself better. And there's a lot of great technologies that I use even to this day that I'll be happy to go into the stuff I've used to heal.
Sure. Like, one of the things we always have to say is we're not giving medical advice here. Speak with your medical doctor. We don't know your case, but please give us anything that you've got. That would be great.
So back in the day, I had done on me, one of the medical doctors that ran our cancer clinic and AIDS clinic in Mexico. He had did live cell therapy back in the early 90s, shipped over from Switzerland back when they were injecting sheep cells. I had those done.
What is live cell therapy? I'm not very familiar with it.
It's the precursor to stem cell therapy. So back in the day, they were actually taking sheep organs or, young sheep organs, freezing them, and then actually injecting that tissue into your body. And it was, if you look at the Paracelsus clinic in Switzerland, the popes had it done. Many great leaders went over to Switzerland for this type of therapy. Now it's advanced way since then. We had one of the original lasers in my practice.
So, Dr. Paul, so that evolved into what's now stem cell therapy?
Yes, that is the original stem cell therapy, or one of.
And for stroke victims, what is there stem cell therapy available, or how does that work?
There is, but you definitely want to find a clinic that has what they have is a government-sponsored research program for it to be done on you. Because really, stem cells can help with a lot of conditions, or they aid in conditions, but they don't treat conditions until they're approved by the government. Then you can say that. But there is definitely some great research on that type of condition, especially available outside the country. There's stuff available here in the country, but you have to look at your doctors and see who's doing the right thing on that. Or listen to your doctors and look for some alternative doctors in your area.
So if we look 30, 40 years in the future, how do you think medicine will evolve at that point?
I think people really are looking for the truth. Just remember, more people died from the Civil War from infections of getting injured than the war itself, because it was crazy to wash your hands in the 1800s before surgery. So, our technology is moving so fast that our countries are eventually going to have to wake up. And even with this COVID pandemic, they're fast forwarding a lot of treatments to try to find an answer. So hopefully at the end of this pandemic, we learn of natural things that help heal the body and get the body back to its true potentiality, because nobody's really talking about that. Your immune system, 90% of it lives in your gut. Get the gut healthy, get the body healtly, and make the body adaptable to the environment.
I had interviewed Dr. Stephen Gundry, who trained or was a vascular surgeon at Loma Linda Hospital, on my other podcast, and he spoke a great deal to that so much healing comes from the gut bacteria, feeding the right bacteria. And
Gundry's products are excellent. I've used them before.
I tried his Vital Red. I thought it was also awesome.
Yeah, very good.
Yeah.
So another thing I've used is chiropractic adjustments, very powerful, getting the body tuned in, because you have to do a lot of neurological retraining. I've also had different types of laser therapy on my brain and on my spinal cord, which has been really helpful. There's another device called a quantum QRS. It's a magnetic pad. It's a pulse electric magnetic field, which stimulates your immune system very powerfully and your body to stay very healthy. They actually used it on the Mir space station. NASA's done a bunch of research with this. It's a magnetic field electric field that I lie on every night before I go to bed for 10 minutes and when I get up in the morning, and it really helps manage my symptoms and my energy levels.
And when you had the brain trauma, did you find that it decreased your energy levels?
With the brain trauma, it definitely decreased my energy levels. And what really helped bring a lot of that back was getting my gut straightened out through some of the cleansing and the detoxification programs we do in our office. Plus, I had some stem cell therapy done on me.
Dr. Paul, let me ask, does any of that therapy involve ice cream or chocolate?
I think ice cream and chocolate is really the true answer to it all.
That's what I thought.
Everything else, is
everything else is
secondary.
And I got one more question for you, very seriously. How many tickles does it take to make an octopus laugh? A really bad dad joke. How many tickles does it take to make an octopus laugh?
Probably 300. I don't know.
That's good. It's actually 10 tickles. You get it? Oof, I got to throw one bad joke in every once in a while, you know? So we've totally displaced that ice cream and chocolate theory, huh?
Well, I think everything in moderation is okay, but really finding what triggers your body and what lights up your immune system or that cause your immune system to fire off. And there's testing you can do, and there's symptomology checking you can do, and there's ways you can do to really look at your inflammatory responses, because the main thing we're trying to deal with patients is managing inflammation. Inflammation is involved with so many different processes, and as you begin to control the inflammation, and even COVID itself is an inflammatory process called the cytokine storm. And it's a crazy inflammatory response that's happened to the body. So how you manage your inflammation on a day-to-day basis is very, very important.
Dr. Constante, what is the theory behind chiropractic and inflammation? How does that work?
Well, you can kind of look at chiropractic as a neurological process in terms of basically you have your dorsal column of your spinal cord, nucleus cuneatus and gracilis, and those control your postural levels. But also the dorsal column of your spinal cord is where your T cells are actually mediated. And they've figured out that your brain actually extends from the brain all the way through the spinal cord, because it's both gray matter, the brain and the cord. So as you do adjustments to the body, it can actually change your cellular mediated immunity. I don't tell patients, though, that I'm here to change their immunity. All I tell them is we're here to help God's energy move through the body and heal the way it was designed to. And then over time, we watch the responses. And I don't tell people to get off their medicines and do that. What I tell them is listen to your doctors, but let's make a better version of you as we get your body to be able to heal itself.
I love it. I love it. Dr. Paul, one more question. You said your parents flew down when you had this. How did your family react to this whole accident? Were they devastated? Were they?
You know, it happened a few days before Christmas, so they were a bit devastated, but I've been a skateboarder and a skier since I was 12, and I had probably been in the hospital a dozen times before that with other injuries.
So they were like, oh, it's him again.
I mean, so they did well with it. I have great parents. God bless their souls, but they took really good care of me and raised me right.
And did you, in terms of lessons that you learned in terms of people, any lessons that you got out of this injury that you sort of walked away with that changed your viewpoint of
the biggest viewpoint, whenever I'm unhappy or when I'm not really being the best I can be, I forgot that I'm not serving. And what I learned that life is about washing feet and serving your mankind. And when you're really there helping other people and serving patients and serving people around you, that's when your heart shines and you get happy. And it's so easy to forget that. And God's probably given me 20 lives beyond 9 lives, because I still mountain bike and ski and do some, I would say, not the smartest things, but I don't think my brain's the best, but it is. But the big thing is learning how to, just remembering, live a life of service, live a life of helping people. And it always seems to work its way out. And when you're not helping people is when life seems to not go the best.
And Dr. Paul, what got you through the difficult times in terms of faith, or like what would you say got you through the worst times? The family, the friends, the
family, friends, and faith. And especially when the faith went away, you start creating your own demons. And when the faith is there, you really understand that, you can create your own demons, and you really got to rise above it.
Well, everything you said, you were certainly a great example of. And I'm actually very proud to call you a friend. And thank you so much for coming on the show. And God bless you. And you've done great. And looking at you, I mean, it's unbelievable that you went through what you went through, because you certainly came out the other side of adversity perfectly, man.
Well, I'm always trying to figure out how to keep myself better, how to manage yourself. And my, one parting thing is no matter where you are at adversity, God designed this for you to win. And just remember, the greatest basketball games in life are 99 to 98. You got to give up 98 points to win that thing. So, just stay on that path. And anybody's welcome to reach out to me or my facility. I'd be happy to help you understand or refer you to somebody in your area. And we even do some remote types of treatments, especially with the immune system stuff and how to fix the microbiome of the gut.
Dr. Paul, how would they do that? How would they get in touch with you, sir?
You can call 502-426-9200 or dynamicmedrehab.com on the contact page. Hit contact us. That's dynamicmedrehab.com. Or you can reach out on my email at drconstante, drconstante @yahoo.com.
Thank you, Dr. Paul. And I have called you many a time, like in the middle of the night going, Dr. Paul, let me ask you a question. I got this patient. What would you do in this situation? What is some of the cutting edge stuff? And you have given me some great advice, and I absolutely appreciate that. And I think today your advice about maintaining your faith and looking at it as a game and just maintaining a positive attitude will help a great many people, and it's truly appreciated.
Oh, I appreciate you having me on the show. Thank you so much.
Thank you.